Hello everyone, thank you so much for joining us today in our Hashimoto's disease workshop. We are Stay Healthy. At Stay Healthy, we are an organization that we want to create awareness and educate women about being healthy, and also for them to know about what illnesses they can have. Hashimoto's disease, and in this workshop, we are so happy. If you are here for the first time, we are so happy to have you. If you've been here before to one of our workshops, you are very welcome. We really appreciate you, and we are happy of your support and continue being with us. Today, we're going to talk about Hashimoto's disease. And to that, let me talk to you a little bit about our thyroid gland. Our thyroid gland produces hormones that regulates our body. When our thyroid gland doesn't work properly, it can affect a few of our internal organs, like the heart and the kidneys. There are different types of thyroid disease: hyperthyroidism, hypothyroidism. We can develop a cyst in our thyroid, and sometimes even cancer in our thyroid. Hashimoto's disease and some other illnesses that affect our thyroid gland. But today we're going to talk about Hashimoto's disease. Hashimoto's disease is an inflammation of our thyroid gland. Affects mainly middle-aged women, but it can affect also men and children. When our thyroid is inflamed, it doesn't produce enough hormones to regulate our metabolism. Some of the symptoms of Hashimoto's disease I would like to emphasize. They are hair loss, fatigue, shivering, depression, and weight gain. And the reason why I would like to emphasize in these symptoms is because these symptoms can be confused with some other symptoms. I am very sure if I ask you to raise your hand if you have one or two of the symptoms, almost everyone in this room will raise their hands. And because these symptoms are so common, we tend to just kind of discard it. Sometimes at this moment in our life, we're going through different situations. Maybe we have the death of a loved one, and we feel depressed, and we start gaining weight, and we feel cold when everybody's feeling hot. And also, if you're starting going to menopause, then you can experience some hair loss, or you can have also the cold or the hot situation. You can feel fatigue all the time. That's why it's so important to recognize these symptoms as a possible symptoms for Hashimoto's disease. And we need to pay a special attention, because when we go to see our primary care provider, for him be able to do a correct diagnosis, he's going to ask us, how long have you been experiencing hair loss? Or for how long are you been feeling fatigue? Or since when you start gaining weight? And it's important because to diagnose Hashimoto's disease is a combination of our medical history with the results of our blood tests. So, if you think you have menopause, and you very well can go through menopause and have a few of these symptoms, but I think it's worth it for us to ask our primary care providers about the Hashimoto's disease. Like I said, many symptoms of the Hashimoto's disease can be confused with other illnesses. That's why it's important to get our thyroid checked. And also, let's talk among each other. Let's express how we feel so that we can make sure we are not having some other symptoms, or that we are not having Hashimoto's disease. It's so important for us to talk among each other, because that helps us heal, that helps us stay healthy. And like I mentioned at the beginning, we are committed to you. We are committed to bring awareness and education to women so that you can make informed decisions about the health, your health, and the health of your loved ones. Stay healthy. Stay healthy will help us be our most fruitful and or the best life that we can have. Please stay healthy, because it looks good on you.